Now, more than ever, wellness is a top priority for many. I hear it all the time from family, friends, and even my patients. They're all looking for ways to maintain a healthy lifestyle. That being said, there's a real focus on staying fit, being mindful of what we eat, and observing proper safety protocols. And medical facilities like hospitals play a huge role in keeping our health in check. Now, during these challenging times, there are those who may find it uncomfortable or they're uneasy about going to the hospital. And St. Luke's Medical Center recognizes that. It's responding to this need by adding an extra layer of care for patients who are worried, anxious, and perhaps even paranoid. But how does that work? We're joined today by Dr. Arturo de la Peña. He's the President and Chief Executive Officer of St. Luke's Medical Center. Good morning, sir, and glad you could join us here on New Day.
Good morning, Doc Felix.
Now, Doctor, St. Luke's has been around for many, many years now, and you continue to evolve by taking patients' journey to a whole new level. Please tell us more.
Well, you see, the component of good healthcare depends on three main factors: the outcome of the treatment, the safety of the patient, and the great patient experience. The last one is being neglected most of the time, but it is as important as the outcome and patient safety. So we are now going to focus on the patient journey. The patient journey means the time that the patient develops symptoms until they consult the hospital and that those symptoms are resolved by the treatment. And when they get out of the hospital, what advice are you going to give them? This is very important because if you improve the outcome, the patient experience, you increase trust and compliance of the patient. And once the patient is compliant, you have better outcome in terms of results of treatment. And then you reduce the cost. And most importantly, you build up continuously your brand. And eventually, it is going to be transformed from the business side of better financial performance.
Now, one of the highlights of the program is the Patient Care Navigator. And this means that patients will be well guided from the time they set foot at the hospital to the time they're ready to go home. Now, off the bat, patients will feel more secure, safer, and most importantly, they were well attended to. Now, what can patients expect from this program, sir?
When this program was conceptualized, we look into the patient journey map and we walk the patient journey map ourselves. And in the process, we involve a lot of people. We even include former patients so that in each and every part of the journey, we look into the pain points because we prioritize the pain points and then we strategize on how to further improve or change the pain points into wow points. So we are now focusing initially on the high volume areas because to put order into the flow of patients there, we are going to assign patient journey navigators that will make the journey of the patients into the hospital convenient, seamless, and safer.
And St. Luke's Medical Center also worked on giving patients a different kind of experience, a hotel experience, if I may say, versus making them feel worried about being in a hospital. Now, as it is, syempre, people who go to the hospital mostly have medical or health concerns with them. Now, tell us about the enhancements you've made in the hospital rooms.
Now, number one is to assure the public that it is safer to go to the hospital. So the hospital is very strict in following up the infection control guidelines of allowing patients to go to a health service provider. So we assure that it is safe to go there by adhering in addition to physical distancing, wearing masks, face shield, and we provide adequate health sanitation facilities so that they can clean their hands whenever they get in touch with every part of the hospital. And in addition, we provide different areas for COVID patients and not COVID patients. For example, we provide dedicated elevators, we provide dedicated equipment, and we provide dedicated people so that there will be no opportunity to expose other patients to COVID infections. So to me, the hospital is the safest place to go, especially if the hospital adhere to the strict criteria in terms of disease control and prevention. Now, the enhancement focus on different areas, specifically on the room. We provide enhancements. There are new bed essentials. We change the linen because traditionally the linen is white. And we have found out in our research that the white linen contribute further into the worry of the patients. If you provide printed comforters and bed sheets, it is converted into a homey environment, and studies have shown that when you do so, the recovery of patients from the treatment is better. We provide complimentary drinks, coffee, complimentary mini bars, but we focus on water as well as fruit juices. And we provide digital compendium that will provide the patient information on hospital concierge services. And more importantly, there is now an additional phone deck for charging of their equipment as well as telephones, iPads, and computers. So when you do so, these are neglected ones. And you would wanted to eliminate all of these things, small things for some people, but it matters most in many of the patients as well as their relatives. Also,
And finally,
the
Dr.
discharge process and the admissions are enhanced or become better now because upon discharge, you can do it right at your own room. You don't have to go into the cashier as well as the billing section of the hospital. That lessen also the exposure of patients to other sick patients, especially the relatives of the patients who are well. And the discharge is facilitated as well as the admission. When you go to the admission, we coordinate with the doctors and they tell us the admission so that when the patients arrive at the admitting division or section, they probably will stay less than 10 seconds and then will be brought immediately into their rooms. That will provide comfort, convenience in most of our patients, and these are very important based on the survey of the feedback that most of the patients have given us in the past.
And finally, Dr. De La Peña, how about the doctors at St. Luke's? How are they doing during this pandemic? How are they adapting or evolving during these unprecedented times?
Yes. Well, our message is we must always assure them of the safety when going to the hospital. Second, for some people who do not want to go to hospital, we developed and further improve our telemedicine capabilities, so that patients can consult their doctors at the comfort of their homes, and also on the part of the doctors, they can do it anywhere when they are contacted by our patients. And we invested on technology and equipment to be able to attend to all of the pain points in the patient journey, from the admission, from the arrival to the hospital, during their stay in the hospital, and up to the time they are discharged from the hospital. As much as possible, we wanted the journey to be seamless and well coordinated so that this is converted into an enjoyable stay into the hospital, because when you do so, studies have shown that you increase compliance to the treatment, and when you comply, the treatment is better and the outcome is better, it is going to be cheaper. So that's the philosophy of paying particular attention to patient experience side of treating patients in our hospital.
Thank you for joining us this morning here on New Day, St. Luke's Medical Center, and CEO, Dr. Arturo de la Peña.